Child has mid-ground fracture in a permanent maxillary incisor. Several months ago, the pulp is now necrotic. Radiographic examination revealed incompletely formed root. With an open apex, treatment of choice is apexification. Exarticulation of teeth means avulsion. Change of the color of the traumatized teeth is evident in 2 to 3 weeks after injury. The most common age group of fracture of permanent teeth is 8 to 12 years of age. Endodontically treated posterior teeth are more susceptible to fracture than untreated posterior teeth. The best explanation for this is destruction of corneal architecture. In primary teeth, intrusion is common because of alveolar bone is pliable. Concussion trauma in maxillary anterior due to the trauma shows sensitivity to percussion. Necrosis and degeneration in short time is seen in avulsion. A tooth reimplanted and after 2 years it gives sound of hard stony. What is the diagnosis? The answer is replacement resorption. Pain due to thermal change after trauma will occur during root fracture. What is the treatment in child having lateral luxated teeth which are not in occlusion? Wait and watch. Source of calcium ion in dentinal bridge is blood. 8 years child has fractured his maxillary central incisor. 10 months ago, the pulp shows no response. There is no periapical lesion in the radiograph. Treatment of choice is complete debridement and apexification. In case of tooth is non-vital and the apex is still open. Celiac pulpotomy is also called partial pulpotomy. A patient comes with avulsed teeth with 60 minutes of trauma. Treatment protocol involves minocycline or doxycycline 1 mg per 20 ml for 5 minutes. According to IADI recommendation for splinting time and type of various type of injuries. In case of subluxation, 2 weeks. Treatment of choice is flexible splint. Extrusive luxation 2 weeks. Flexible splint. Intrusive luxation 4 weeks. Flexible splint. Root fracture 4 weeks. Flexible splint. Root fracture cervical third 4 months. In case of avulsion 2 weeks. In case of avulsion dry time more than 60 minutes 4 weeks. In case of alveolar fracture 4 weeks, no recommended action is needed. After dental trauma, it may take several months, almost 6, for normal blood flow and response to the pulp test to return, making it important to monitor pulp vitality over time. Sensitivity tests evaluate nerve condition and non-circulatory condition. False negative are more likely than false positive. After trauma, immediately vital tests done is checked for baseline comparison. What is kinosophobia? It is fear that moving your body will cause pain, injury, so the person avoids activity. Healing type with calcified tissue. Radiographic features are the fracture line is visible but the fragments are in close contact. Healing with interproximal connective tissue, the fragments appear separated by a narrow radiolucent line and the fracture edges appear rounded. Healing with interproximal bone and connective tissue. The fourth one is interproximal inflammatory tissue without healing. Thank you very much.